Good afternoon, everyone. Thank you for joining us today. We are joined by Denise Easter. Denise is with the Oklahoma Healthcare Authority, and she is going to be sharing her project, her QI project that she works on, which is the Fluoride Varnish project. And just a little background information. I met Denise at our Rural Health Conference at the end of October after one of the sessions about rural health clinics, and she mentioned her project. And I was like, well, let's have you on a webinar and record it and get that out there so more folks are aware of your program. So with that said, Denise will be available to answer questions. You're able to come off mute if you'd like, or if you want to put something in the chat, I'll be watching the chat. So with that said, Denise, I'll turn it over to you.
Thank you, Laura. Good afternoon. I am happy to be with you and share with you our Sooner Care Quality Improvement Fluoride Varnish project. I am Denise Easter. I'm a Quality Improvement Manager with Sooner Care, Oklahoma Medicaid, at the Oklahoma Healthcare Authority. Early childhood caries is the most common chronic childhood condition. Caries is a silent epidemic that disproportionately affects the poor, the young, and the minority populations. Caries, which is commonly called cavities, are 5 times more common than asthma and 7 times more common than hay fever. Cavities have the consequences of multiple health problems, including pain, infection, malnutrition, sleep disturbance, and eventual dental work that requires a child to need anesthesia. However, cavities are largely preventable, and one solution is fluoride varnish. The U.S. Preventive Services Task Force recommended that the primary care clinician apply fluoride varnish to the teeth of all infants and children at least every 6 months, starting with the appearance of the first tooth and going through age 5. The American Academy of Pediatrics states that in the primary care setting, fluoride varnish should be applied at least every 6 months for all children. When used twice a year, fluoride varnish reduces tooth decay by 38%. And Sooner Care reimburses for fluoride varnish application in children approximately every 6 months. Under the Affordable Care Act, payers are required to cover fluoride varnish without cost sharing. All major private payers reimburse for fluoride varnish in children. So the problem? Fluoride varnish in the primary care medical setting is vastly underutilized. We wondered why, so we began our quality improvement project by surveying members and providers for Sooner Care in a few test counties. We found that our members were underinformed about the benefits of fluoride varnish and unaware of the availability of a child getting fluoride varnish at the medical clinic. Also, over 70% of our primary care medical clinics had not done fluoride varnish in the past 6 months. The barriers most often cited to us were time, staffing, and clinic routine. What caught our attention were the 29% of clinics who were doing fluoride varnish. These are the outliers in our data. We contacted and interviewed and visited these clinics in order to map their workflow. Now, these clinics looked very different from each other. They were rural and they were urban. They were suburb or inner city. Some of them were very small and some of them were very large. What we found was 4 things all of them had in common. First, each of these clinics spent time training their staff in fluoride varnish. Everyone was included in this training: nurses, techs, students, doctors, assistants. Everybody got fluoride varnish training. Next, fluoride varnish was a part of each of these clinics' routine of care. Providing fluoride application was not stepping outside of their normal work process. It was part of the well child check, just like immunizations or lab work. Also, fluoride varnish use was made to be convenient in these clinics. In other words, fluoride was kept next to the immunizations, or it was kept at the nurse's desk for easy access, or in some cases, it was in the exam room with information on dentists and with toothbrushes to hand out. And fourth, fluoride varnish was built into their billing systems. It was listed on their billing forms or added into their computer programs. It was billed with the well child check, just like billing for immunizations. It did not take them outside of their workflow. It was part of their billing routine. By adding these 4 simple steps into a clinic workflow, fluoride varnish can be included in the well child visit, needing no additional time or staff, and as a reimbursable service. If you're wondering about the fluoride varnish procedure itself, it takes less than a minute to apply. It's a disposable brush, comes in several flavors. It costs less than $1 per application, and anyone in the clinic can perform this procedure. Fluoride varnish is not expensive and it's not difficult to provide. These 4 things can easily be shared with other providers and included into any clinic's workflow. And this is the next step in our quality improvement project, sharing and including. Medical clinics interested in increasing the use of fluoride varnish at the well child visit have been recruited and have volunteered. We visited these clinics to discuss the best practice routines for including fluoride varnish, the cost of fluoride varnish, how it's supplied, the financial benefits to providing it, and the barriers faced when trying to add fluoride varnish to their routine. Clinics are given a packet which includes informational flyers on these 4 steps, fluoride fact sheets, applications themselves, toothbrushes to hand out, and a tracking tool. The tracking tools because we need feedback from clinics who are adding these 4 steps and trying to incorporate fluoride varnish into their workflow. We ask that they record their fluoride varnish use and then give us the results. Now, currently, we have these packets to bring to your clinics to help you get started including fluoride varnish into the well child visit. And we will need your feedback. We hope to learn from you. We ask that you record the fluoride varnish use for 6 to 8 weeks and then share the results with us, both your successes and the barriers that you will face. Now, while you're thinking about maybe becoming a part of this project, I will answer some frequently asked questions. What if a child gets fluoride varnish at the dentist and at the well child visit? Fluoride varnish is not ingested. It sets on contact with saliva. So getting fluoride varnish at the dentist and at the well child visit will not give the child too much fluoride. Also, Sooner Care covers fluoride varnish as a medical benefit twice a year in children and as a dental benefit twice a year. So medical coding and dental coding are separate. If a Sooner Care dentist and a primary care clinic both submit claims for fluoride varnish, the claims will not cancel each other out. Both will pay. Who can apply fluoride varnish? Anyone in your clinic. It can be a doctor or a nurse practitioner, a medical assistant, an LPN. Fluoride varnish can fit into the workflow of any clinic. Do we need a certification? Sooner Care no longer requires a certification. Your staff can see a fluoride varnish demonstration in a 2.5-minute video on the Sooner Care website at oklahoma.gov/OHCA and just search fluoride varnish. However, if you want your staff to have additional training, there is certification offered online through Smiles for Life oral health curriculum. Several of our clinics actually use this curriculum for their staff orientation and for teaching on fluoride varnish. And you will find this at smilesforlifeoralhealth.org. And why not simply refer the child to a dentist? Access to care. As you know, we have entire counties in Oklahoma that do not have a Sooner Care dentist seeing children. And children are seeing you. 88% of 1-year-olds are going to the well child visit, while less than 5% are going to the dentist. Here are listed the websites that I mentioned. The Sooner Care website, the smilesforlifeoralhealth.org website, and my email address. Please email me and I will set up a time to come and visit your clinic staff. I can bring you the fluoride varnish quality project packet, and I can get you started. We invite you to participate in the Quality Improvement Fluoride Varnish project. Now, are there any other questions that I can address for you?
Thank you, Denise. Does anyone have any questions while we have Denise on the line? All right. Well, if you're watching this,
Um,
oh, go ahead.
I was
Sorry.
just going to say some additional information that we have beginning in January. We will be actually tracking the use of fluoride varnish in our participating clinics, their use before the project and through claims, and their use after the project. So if your clinic is interested in, it's the percentage rate. It's the percentage of how many fluoride varnish treatments compared to how many well child visits in the clinic. If you're interested in knowing that about your clinic or in participating in the project and then be letting us track it, and we always share our information with you, then we're happy to do that.
Denise, we did receive a question through the chat. Does this have to be done during a well child visit, or could it be any encounter?
It actually can be any encounter. That's a really good question. The well child visit seems to be the most convenient for both the clinic and the patient, but it can be any time, and it is not tied. That's one of the other benefits is fluoride varnish claim is not tied to any other visit.
And then we had another question. How do they bill for it? Are there specific CPT codes or?
There is. I believe it's 99188, but have your staff double check me on that. That is the fluoride varnish in the medical clinic. It's a medical code, and that's what it's claimed. That's what it's for. That's all it is, and it can be claimed on top of the well child visit or on top of the other clinic. It's not tied to another visit.
All right. Are there any other questions? These are good questions.
Yeah, they are.
How much is the reimbursement?
And that
here.
And that one varies. It varies. I even tried to check private payers because I know you have patients that are from a variety of payers. And it varies from about $10, $11 reimbursement up to, I found, as much as $35 reimbursement. Now for Sooner Care, as you know, reimbursement depends on if it's a teaching facility or not a teaching facility, if it's a child in state custody or not a child in state custody. So that's why I don't have a specific amount, because depending on the provider and the patient, it may vary a little bit, but the least amount of reimbursement I found was right at $11, and which is why the fact that it's actually about 85 cents to stock it per application. So that's why that is significant. So the least amount of reimbursement I found was about $11 per application. And like I said, for some private payers, it went on up to $30 or so. And then the other thing is there's a difference in reimbursement age. For Sooner Care, we reimburse fluoride varnish from age 6 months to 60 months. So 6 months to about 5 years. Some of the other private payers, their age range might vary a little bit in that. I think most of them are trying to follow the American Academy of Pediatrics suggestion, which is first tooth to 5 years is their recommendation.
And we received another question. Can an RHC bill this as an extra charge?
I think so. Why don't you email me that question and let me double check and make sure I know the answer to that one. But my tentative answer is yes.
Yeah, I'll be sure and follow up with that one.
Okay.
All right. Are there any other questions? I was just making a note of that.
And I will mention this because I actually have visited clinics in several areas of the state. And one of the questions I forgot to cover was, or I didn't have time to cover in the original slides, was what about fluoride in the water? And fluoride in our water systems is not consistent. We have major cities that don't have fluorinated water. And we have, and then if you're on well water, if you're in the rural areas, you don't have fluorinated water. We actually, interestingly enough, there are a few entire states in the union that the state will not put fluoride in their water. So that's not a dependable way to protect our children's teeth, is fluoride in the water.
Well, Denise, thank you for your time. And we did record this. Denise, will we also be able to send out your slides with the recording?
I let me double check on that and see,
Okay,
because I have to abide by the rules of my agency. So let me double check on that.
totally understand. For everyone on the call or watching the recording, if you have any questions at all, please don't hesitate to reach out. Denise's contact information um, available, but I can also put you in touch with Denise. There she is.
Yeah.
And I can put you in touch directly as well. So
Thank
thank you all. Yes, ma'am.
I was just gonna say, thank you, Laura. I really appreciate this. And I am happy to work with people on this project. And if they have other questions that they want to address, if I don't know the answer, I'll find someone who does.
Perfect. Well, thank you all for your time.